The burden of sepsis at Tampa General is high, and we have a very good program in the hospital that was developed to identify patients with sepsis through several different metrics, from nursing assessment of vital signs to lab work. The importance here is, and which makes the whole difference, is that this information is monitored 24 hours and allows for early diagnosis and treatment. The mortality rates has been greatly reduced and decreased since the implementation of this program. It's really making a difference. I see a lot of benefits of fast AST. As we know, blood infections is serious, and usually we can't wait for the AST results to start treatment. But it's still the AST results, they are very important because that's the way that we are going to confirm if the target therapy is appropriate or if the escalation of antibiotics is needed. One of the scenarios that I think it's very important fast AST is bloodstream infections caused by gram-negatives, because it can progress very fast, and the sooner we can confirm if the treatment is appropriate, the better will be the clinical outcome of the patient. We have only used the VITEC review for research purpose, but we did see a lot of great quality. And what is really unique from this system is that the antibiotics results, they are released independently, so we don't need to wait until the full panel is complete to start seeing the results. Let's imagine one case that the patient is already receiving a treatment, and one of the first results were resistant. So we can contact the provider and they can start adjusting the therapy sooner, instead of having to wait the full panel to be completed. I think it's excellent to have all the results together and integrated. I always say that the lab diagnosis is like a puzzle, and we have to put all the pieces together to have a good result. So it makes really easier to review the tests and interpret the results all together in this integration. It really makes the workflow in the lab much more straightforward, and the whole process becomes more efficient and faster, which can certainly improve the clinical outcomes of a patient.